Medical news from Nature Medicine. Global economic burden of depression in 154 countries from 2025 to 2050. Depression will cost the world economy roughly $12 trillion over the next 25 years, equivalent to about 0.46% of global annual gross domestic product, and that figure climbs to $14 trillion when suicide deaths linked to depression are included. The sheer scale of these losses underscores that depression is not only a health crisis but also a massive economic liability that threatens productivity and growth worldwide. Depression already ranks among the leading causes of disability-adjusted life years, imposing a heavy toll on individuals, families, and health systems. Yet the full magnitude of its socio-economic impact has been difficult to quantify, leaving policymakers without a clear picture of the fiscal stakes involved. This knowledge gap prompted researchers to construct a comprehensive macroeconomic model that could translate the disease's epidemiology into monetary terms, thereby informing both health and economic policy. The investigators built a deterministic macroeconomic simulation that integrated prevalence and disability data from the Global Burden of Disease Study 2021 with labor market and demographic statistics from the World Bank. The model projected the effects of depression on three key productivity pathways: labor force participation, educational attainment, and accumulated work experience, while adjusting for age and sex distributions across 154 countries. Simulations spanned the period from 2025 to 2050, allowing the team to capture long-term trends in workforce dynamics and capital formation. Sensitivity analyses incorporated a range of assumptions about the proportion of suicides attributable to depression, using a conservative upper bound estimate of 60% to gauge the additional economic burden of premature mortality. Across the projection horizon, the model estimated a cumulative loss of $12 trillion, 2024 US dollars, in gross domestic product, translating to an average annual drag of 0.460% on global output. When the 60% suicide attribution scenario was applied, the total burden rose to $14 trillion, reflecting the added cost of lost human capital from premature deaths. The United States and China accounted for the largest absolute shares of this loss, while the relative impact, expressed as a percentage of regional GDP, was most pronounced in North America, where reduced labor force participation and lower productivity per worker emerged as the dominant cost drivers. Subgroup analyses revealed that the economic penalty was not evenly distributed. Low and middle-income regions experienced smaller absolute losses but often faced higher proportional impacts on national economies, highlighting inequities in the burden of depression. Moreover, the model suggested that interventions improving educational outcomes for individuals with depression could modestly offset some productivity losses, though the primary gains would stem from restoring workforce participation. These findings carry immediate implications for clinical practice and health system planning. They reinforce the argument that effective detection, treatment, and ongoing support for depression are investments with measurable economic returns, not merely compassionate care. For clinicians, the data provide a compelling rationale to prioritize integrated mental health services, early screening, and sustained therapeutic engagement, especially in working-age populations. At the policy level, the results bolster calls for increased funding of mental health programs, workplace accommodations, and preventive strategies, as such measures could translate into billions of dollars in saved productivity and reduced premature mortality. The analysis, however, rests on several assumptions that temper its conclusions. The attribution of 60% of suicides to depression represents an upper bound estimate. Actual rates may be lower, potentially inflating the projected economic impact. Additionally, the macroeconomic model simplifies complex labor market dynamics and does not fully capture potential future changes in treatment efficacy, societal attitudes, or demographic shifts, all of which could alter the trajectory of depression-related costs. Nonetheless, even with these caveats, the study delivers a stark quantification of depression's fiscal footprint and makes a persuasive case for treating mental health as a cornerstone of economic resilience. Thank you for watching. For the full article visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.